You need to go from having demonstration programs to figure out how you overall do major system change. Because accountable care is essentially taking responsibility for the care of a population of people with a different kind of payment methodology than we use at the moment, and getting away from fee-for-service. And basically saying we're going to take responsibility for your total health, and I'm going to get a certain budget to do it, and I have to meet certain quality outcomes. And to be able to do that and do it in a large-scale way over time, you need to be able to build a major infrastructure. You need to be clear about the type of an organization you need to have, what kind of governance you need to have, what kind of competencies and talents that you need to have. One of the major pieces of this is to make sure that we're very clear about what the outcomes are. It can't be everything. And it can't be anything that any new organization comes up with and says, look, I want you to be accountable for this and I want you to be accountable for that. We had a lot of discussion around what are the couple of things that you really need to be accountable for? How do you measure it? What do you mean by quality? We suffer at the moment from having so many organizations review all of us and give us different scores based upon their analysis as to whether or not we're doing well or not. It's like, as I used the example yesterday, it's like having a soccer game with 12 players and 50 referees. You need one referee. You need to know in a clear way what the outcomes are. What we're doing in our organization is I am trying, currently not only trying, but I am building the capabilities to take full risk for the bulk of the payments that we get and take on responsibility for the major management of populations and basically end up with all of the competencies that an insurance company has. Because if I go take risk, if I go to an employer or go to a commercial insurer and take major risk, I have to have all of the analytic abilities, all the IT competencies, which are very different than what you need if you are managing a hospital-based system. I need to have all of the staff who know all of the nuance of all of the new regulations. I have to have the medical management people who understand how to manage in a risk environment. And in our organization, we delved into this 12 years ago, and it didn't work that well. So we have to be very careful that people are not overly naive about what it means to be able to do this in a big way. So what I want to be able to do long term is I want to have the equivalent of an insurance company in my organization, where I take full risk and I completely turn the whole way I deliver healthcare in many ways upside down. If you're going to be responsible for managing the overall care of a population or an individual, it is a lot more than medicine. You've got to deal with substance abuse, mental illness, behavioral health issues, disability issues, the social environment. So it's not just about having good doctors alone. It's the whole constellation of the services that a person who is in dire need needs. Family support services. You need to help with housing issues, with domestic violence issues. So this is because 70% of all of the cost of healthcare basically is determined by social environment and by lifestyle and behavior. You'll have to deal with issues of obesity, issues of nutrition, issues of lack of exercise. These are not things that the normal the delivery system, as we now know it in healthcare, actually addresses on an ongoing basis. So this is a complete shift. It is about health, not just medicine.